Hello, friends. Imagine standing at the pharmacy counter in the first week of January. You are there to pick up the life-saving insulin you need every single day just to stay alive. Usually because the new year just started and your insurance plan's massive annual deductible has completely reset. The person behind the register looks at the screen and demands $300 for a single vial. For decades, millions of hardworking seniors across this country have been forced to drain their checking accounts or dangerously ration their doses, skipping shots just to survive the winter. But for 2026, things are completely different. You hand the pharmacist your card, they scan the box, and the register rings up exactly $35. No questions asked. For millions of diabetic seniors, this isn't a dream or a piece of wishful thinking. It is a hard federal law under the Inflation Reduction Act. But I want to be perfectly clear right from the start. This is not a random stimulus check or a free government handout. This is the official, federally mandated Medicare $35 out-of-pocket cap on covered insulin products, and the appeals processes we cover are exact legal Medicare guidelines. You need to stay with me until the very end of our conversation today, because I am also going to reveal the terrifying pump versus pen billing trap. This is a bizarre Medicare loophole where the exact same liquid insulin can cost you $35 or over $400 out of pocket, depending entirely on the specific piece of plastic you use to inject it. If you don't know how this loophole works, you will end up paying the higher price completely by accident. Now, the rules governing your retirement and your health coverage change every single year, but the government never calls you up to explain your options. The people who subscribe to this channel find out about these massive financial shifts in time to protect themselves, while the people who don't subscribe usually find out after their hard-earned money is already gone. Go ahead and hit that subscribe button right now, so you never miss an update that affects your wallet. Let us look at the foundation of this entire system, which is the federal insulin price cap itself. Under this law, the federal government legally caps your out-of-pocket costs at exactly $35 for a 1-month supply of each covered insulin product. I want you to notice that phrasing carefully. It is not an inflation-adjusted number, and it is not a percentage-based copay where you have to do algebra at the cash register. It is a flat, hard $35 ceiling per month per covered insulin, but this protection is not entirely automatic. To make sure you actually get this price, you need to take a specific set of steps. First, log into the official Medicare Plan Finder tool during open enrollment or pull out your current written evidence of coverage document. Second, verify that your exact brand of insulin is explicitly listed on that plan's formulary, which is just the insurance company's master list of covered medications. Third, bring your prescription to a pharmacy that is inside your plan's network. Finally, look at the screen before you hand over your money to ensure the register rings up exactly $35 or less. Let us walk through how this looks for a real person. Think about John, a 70-year-old retired worker living out in Texas. John takes a long-acting insulin called Lantus. The actual retail price at his local pharmacy counter is roughly $300 a month. Before this federal law went into effect, John had to pay that full $300 completely out of his own pocket during his coverage gap phase, forcing him to make impossible choices about his monthly budget. Now, the law forces that price down to $50. John pays exactly $35 at the counter, which means he saves $265 every single month. When you walk that math out over the course of a full 12-month calendar year, this single cap retains $3,180 in pure cash flow inside John's retirement bank account. That is money he gets to keep for his groceries, his utilities, and his life, rather than handing it over to an insurance corporation. But what happens if your medical situation is a bit more complicated? If your doctor determines that you require multiple types of insulin, for instance, if you use a long-acting basal insulin to keep your numbers steady throughout the day, and you also take a rapid-acting mealtime insulin right before your dinners, the $35 cap applies to each individual product separately. In this exact situation, you will pay $35 for the long-acting vial and $35 for the rapid-acting vial. That brings your total to $70 a month for your complete daily insulin regimen. The insurance company cannot lump them together to deny you the cap, but they also do not have to give you both for a single $35 payment, This brings us directly to the second major protection you have under the law, which is the deductible bypass rule. This is where a lot of seniors panic when the calendar flips over. Millions of people walk into the pharmacy in January or February and get terrified because they know their Medicare Part D prescription drug plan has an annual deductible that can run as high as $590 in 2026. Under normal insurance rules, you are required to pay 100% of the full retail price for your medications until you have paid that entire $590 out of your own pocket. If your drug costs $300, you pay $300 until that deductible bucket is empty. However, the federal insulin law explicitly overrides this deductible phase completely. The law states that the pharmacy is legally banned from making you pay full retail price for covered insulin, even if it is 8 o'clock in the morning on New Year's Day and you haven't spent a single penny toward your annual deductible yet. Here is exactly how you handle this at the checkout counter. When you walk into your pharmacy in the month of January, pay close attention to what the person behind the counter tells you. If the pharmacist looks at you and says your bill is $300 because your annual deductible just reset for the year, stop them immediately before they process the transaction. State clearly and firmly, covered insulin is exempt from the Part D deductible under the Inflation Reduction Act. Once you say those words, have them rerun the billing code through their system, which will manually trigger the $35 override. Look at how this functions for a senior named Susan. Susan has a standard Part D plan with that full $590 annual deductible. She walks up to the counter on January 2nd because she needs to refill her monthly insulin prescription, but she also needs a brand name medication to manage her blood pressure. Because of the federal override, Susan pays exactly $35 for her insulin, bypassing that massive $590 hurdle instantly and saving $265 on that single visit. But here is the critical catch you must remember. This legal override only applies to covered insulin products and specific covered vaccines. For her brand name blood pressure pill, Susan cannot use the override. She must still pay the full retail price for that medication at the counter until she completely exhausts her $590 deductible limit for the calendar year. You also need to understand how this interacts with your long-term out-of-pocket limits. Because the $35 cap bypasses your deductible, the $35 you actually pay out of your pocket does count toward your true annual out-of-pocket maximum, but the $265 that the insurance company was legally forced to absorb on your behalf does not count toward meeting that $590 deductible for your other medications. This brings us to a dangerous trap that insurance companies are using to protect their profits, and involves what happens when a brand is completely dropped from coverage. This is what I call the uncovered brand trap, and it is a reality that catches thousands of seniors completely off guard every single year. The $35 federal cap is not a blanket magical piece of protection that covers every single drop of liquid insulin in existence. The law is written very precisely. It only applies to insulin products that are actively sitting on your specific insurance plan's formulary. To protect their own bottom lines and corporate profit margins, insurance companies frequently drop expensive name brands from their coverage lists from one year to the next, replacing them with a single preferred alternative that they negotiated a cheaper deal on. If you walk up to the counter and try to buy an uncovered brand of insulin that your plan dropped, the federal $35 cap provides you with absolutely zero financial protection. To make sure you do not fall into this trap, you have to follow a strict timeline every autumn. First, look out for your mail carrier in September and locate the written document called the Annual Notice of Change Letter that your insurance plan is legally required to mail to your house. Second, open that letter up and go straight to the section labeled Formulary Changes, then look for the exact brand name of the insulin you inject. Third, if you see that your specific drug has been dropped for the upcoming year, you must take action during the annual open enrollment period. You either need to have your doctor switch your prescription to the plan's new preferred covered brand, or you need to shop around and switch your entire insurance plan to a different company that still covers your current brand. Fourth, write this rule down on a piece of paper. Never assume last year's coverage guarantees this year's coverage. Let us look at a real-world example of how skipping this step can devastate a retirement budget. Take Robert, a senior who takes an insulin called Nivolog. his 2026 Part D plan quietly decides to drop Novolog entirely from its formulary, replacing it with a different brand called Humalog as their single preferred option. Robert does not open his mail in September, assuming everything stays the same. He walks into his pharmacy in the first week of January to get his usual refill. Because Novolog is no longer on his plan's formulary, the $35 federal cap completely vanishes for that drug. The pharmacist handles him a bill for the full $350 retail price if Robert simply stops, calls his doctor, and asks for a new prescription for Humalog, the alternative brand his plan actually covers. His price at the register instantly drops right back down to $35. By ignoring that one single piece of mail in September, Robert would have thrown away $315 a month, which adds up to a staggering $3,780 over the course of a single year. Now, some seniors have severe physical allergic reactions or unique medical complications with specific brands of insulin, meaning they absolutely cannot switch over to the insurance company's preferred choice safely. If you find yourself in this exact situation, you do not have to just sit there and take it. You have the legal right to fight back using a powerful federal mechanism known as the Formulary Exception Appeal. Under federal guidelines, if your prescribing physician can medically prove to the insurance company that their preferred insulin alternative is dangerous for your body, ineffective for your blood sugar control, or causes severe adverse reactions, the insurance plan is legally forced to grant an exception and cover your original brand. The moment you win that appeal, that specific off-formulary drug is added to your personal customized formulary list, and the federal $35 cap activates immediately. To launch this appeal, you must execute these steps in order. First, contact your prescribing physician and have them write a formal detailed document called a Letter of Medical Necessity. Second, call the customer service number on the back of your Medicare Part D insurance card and explicitly state that you are requesting a coverage determination for a formulary exception. Third, submit your doctor's written letter directly to the appeals department to prove you cannot use their cheap alternative drugs safely. Finally, do not stand at the pharmacy counter paying full retail prices out of pocket while you wait for the insurance company to read the paperwork. Ask your doctor's office for free sample vials of your required insulin to tide you over until the formal appeal officially clears. Think about how this saved Mary's budget. Mary has a severe allergic reaction to Humalog, which happens to be the only rapid-acting insulin her particular plan decided to cover for the year. To stay healthy, she has to use an off-formulary brand that carries a retail cost of $400 a month. Mary does not panic. Her doctor submits the formal exception appeal directly to the insurance company, detailing her severe allergy risks. Under the law, the insurance plan has exactly 72 hours to review the case. They approve the exception, moving her required brand onto her approved list. Instantly, that $400 retail price is crushed down to the $35 federal cap. Mary keeps $365 a month in her own pocket, saving $4,380 a year simply because she knew how to exercise her federal appeal rights. The standard time for an insurance company to rule on a coverage determination is 72 hours, as Mary experienced. But you need to know the variation to this rule. If your doctor notes on the paperwork that waiting a full 3 days to get your medication will put your life or your immediate health in severe jeopardy, meaning you are at risk for a critical diabetic emergency, the law allows you to request an expedited appeal. This designation legally forces the insurance company to hand down a final decision within 24 hours flat. This brings us directly to the curiosity tease I mentioned at the very beginning of our talk. The terrifying pump versus pen billing trap, which turns entirely on the difference between Medicare Part B and Medicare Part D rules. If you are a senior who is transitioning from using traditional disposable insulin pens over to using an electronic body-worn insulin pump, the way your liquid medication is billed changes completely under the law. Insulin that you inject using a disposable pen or a standard syringe from a vial is classified as a pharmacy benefit, which means it is billed directly to Medicare Part D. However, liquid insulin that is pumped through a traditional, electronic, tubed insulin pump, like a Medtronic device, is legally classified as durable medical equipment. Because it goes through a piece of physical machinery, that exact same liquid insulin is billed to Medicare Part B. Both of these programs cap your insulin cost at $35 a month, but if you walk up to the wrong counter or hand the wrong card to the wrong supplier, the system will completely reject your claim and hit you with a massive bill. To stay on the right side of this billing divide, follow these rules. First, look at your delivery method. If you use a disposable pen or standard needle, you are under Part D. If you use a traditional electronic pump, you are under Part B. If you use a traditional electronic pump, you are under Part B. Second, if you are a pen user, walk into a standard retail pharmacy and hand them your prescription along with your Part D card. Third, if you use a traditional pump, you cannot buy your insulin at the regular pharmacy counter. You must order your liquid vials through an approved durable medical equipment medical supplier, and you must give that supplier your red, white, and blue traditional Medicare Part B card or your unified Medicare Advantage card. Look at what happened to David when he tried to get his refills. David uses a traditional tubed insulin pump to manage his blood sugar. He drives down to his local Walgreens retail pharmacy, walks up to the counter, and hands them his Part D prescription card to buy the liquid vials needed to fill up his pump's reservoir. The computer system immediately rejects the entire claim because the back-end software flags David as an active pump user. If David does not know the rules, he might panic at the counter and pay $300 out of pocket just to get his medicine. But because David watches this channel, he knows the law. He leaves the store, calls his official Part B durable medical equipment supplier, and has them process the order instead. Part B handles the claim perfectly, applies the federal cap, and David pays exactly $35 for his monthly supply, keeping $265 safely in his bank account by routing the bill to the correct federal department. But you must be aware of a very complex variation involving disposable patch pumps, such as the Omnipod or the V-Go systems. Unlike traditional tubed pumps, these wearable disposable patches occupy an incredibly complicated gray area in federal coding. Depending on the exact model number you wear and how your specific insurance plan classifies the device, these patch pumps are sometimes billed under Part D pharmacy rules instead of Part B medical equipment rules. You must sit down with your doctor and your medical supplier to verify the exact billing codes they use before you place an order. This dynamic leads us straight into another major calculation error that happens when seniors try to buy their medications in bulk to save trips to the store. This is the multi-month cap math, and it applies directly to any senior who prefers to use a mail-order pharmacy service or buys a 90-day supply at a local retail counter to avoid driving to the store every single month. The federal law is written very strictly. It guarantees a $35 cap per 1 month's supply. When you buy your medication in bulk, that federal protection multiplies perfectly along with the timeline. That means a 60-day supply is legally capped at exactly $70, and a 90-day supply is legally capped at exactly $105. However, the automated computer networks running behind the scenes at retail pharmacies frequently glitch when processing these multi-month overrides. The software will often apply the $35 cap to the very first month of the prescription, but then accidentally charge you the full uncapped retail price for the remaining 2 months of the order. To keep your bulk orders from draining your account, you must act as your own financial auditor. First, ask your prescribing doctor to explicitly write your insulin prescription as a full 90-day supply to minimize your trips to the pharmacy. Second, calculate your exact legal maximum out-of-pocket liability before you ever step foot near the cash register using the math of 3 months multiplied by $35, which equals exactly $105. Third, if you look at the customer screen at the pharmacy and the register demands $235, stop the entire transaction immediately. Fourth, tell the clerk that the Multi-Month Inflation Reduction Act override code failed to process correctly and demand that the pharmacist manually adjust the electronic billing codes to secure your lawful $105 cap. Let us look at how this software error affected a senior named Linda. Linda uses her insurance plan's official mail-order pharmacy service to get a 90-day supply of her daily insulin delivered straight to her front door. The mail-order billing computer suffers a standard system glitch. It bills her $35 for the first month's vial, but then tacks on the full retail price of $200 each for months. 2, and 3. When Linda opens her delivery, she finds an invoice demanding a payment of $435. But Linda knows the federal law backward and forward, and she knows a 90-day supply cannot legally cost her more than $105. She calls the mail order billing hotline, challenges the invoice, and tells the supervisor exactly which federal override code failed. The billing agent manually corrects the software error, and Linda pays exactly $105 instead of $435, instantly keeping $330 inside her checking account on that single delivery. You should note this situational variation. Insurance-owned corporate mail-order pharmacies usually have this specific coding perfectly automated inside their mainframes, but independent local neighborhood pharmacies are highly prone to these multi-month billing glitches. You must look at the paperwork every single time you buy in bulk. This brings us to our final piece of technical protection, which is how your monthly insulin costs incurrate with the ultimate safety net, the $2,000 out-of-pocket maximum. In the calendar year of 2026, the federal government has instituted an absolute maximum true out-of-pocket cap of exactly $2,000 for all covered Part D prescription drugs. Every single $35 insulin copay you make at the pharmacy counter legally counts toward building that $2,000 safety net. Once your total combined out-of-pocket pharmacy spending across the entire year hits that $2,000 mark, your $35 insulin copay vanishes completely and your insulin becomes 100% free for the remainder of the calendar year. To make sure this safety net drops into place properly, follow these tracking steps. First, monitor your out-of-pocket spending every single month by opening the printed explanation of benefit statements that arrive in your mailbox. Second, note that your $35 insulin payments are actively stacking up toward your annual $2,000 limit. Third, if you take a massive financial hit because you have to fill an expensive brand name heart medication, a blood thinner, or a cancer pill early in the year, watch your running total very carefully. Fourth, the exact moment your annual out-of-pocket spending crosses over that $2,000 line, verify that the pharmacy register reads exactly $0.00 for your insulin refills. Think about how this works out for Richard. Richard pays $35 a month for his covered insulin, which adds up to $420 over a full year. However, Richard is also prescribed a highly expensive brand name heart medication in the month of January. Between the cost of that brand name heart pill and his monthly $35 insulin copays, Richard completely hits his $2,000 out-of-pocket maximum by the end of April. Starting in May, his $35 insulin copay drops to $0. For the remaining 8 months of the year, his insulin is completely free, saving him an additional $280 in cash, simply because his early insulin payments helped him cross that federal safety net line faster. But if you are a senior living on a limited income, there is a vital variation to this rule you must know. If your income and assets are low enough to qualify you for the federal Extra Help program, also known as the low-income subsidy, your daily insulin will not even cost you $35. The Extra Help program completely overrides the $35 cap and drops your out-of-pocket cost down to the lower statutory copay limits, which range from roughly $4.50 to $11.20, providing you with absolute poverty protection from the very first day of the year. To summarize everything we have uncovered today, the federal insulin price cap guarantees that you pay no more than $35 a month for your medication, a protection that completely bypasses your annual Part D deductible even on the first day of January. However, you must read your annual notice of change letter to ensure your insurance plan hasn't dropped your brand from the formulary. And remember that you can file a formal formulary exception appeal with a doctor's letter within 72 hours to force coverage for a medically necessary drug. Watch out for the billing trap when switching to an insulin pump. Watch out for the billing trap when switching to an insulin pump, ensuring you route your bills to Part B durable medical equipment suppliers instead of Part D pharmacies, and make sure your bulk 90-day orders are manually processed at exactly $105 to avoid retail system glitches. Finally, know that every single $35 copay brings you closer to the $2,000 out-of-pocket maximum. where your life-saving medication becomes completely free for the rest of the year. The federal government has finally outlawed the devastating price gouging of life-saving insulin, but you must actively monitor your plan's formulary and billing codes to ensure the insurance companies don't quietly slip those costs back into your pocket.